The world is on a coronavirus lockdown. How is this going to affect Western Riverside County, and what can we expect in the upcoming months? It's March 18th. This is Steve Manos, and I'm giving you the Manos Report. Now, before we get started, most of you watching this either know me as a friend, family member, or as an elected official. It's important to mention that this video it's all me. This is not a representation of the city or any other organization. I'm filming with my own equipment and relaying information that has been collected from a variety of official sources, all packaged and tied up with a bow for your viewing benefit. For reasons that should be clear to anyone with eyeballs, we all seem to have a lot more time on our hands. For the past few days, I've received numerous calls from individuals seeking advice, guidance, and maybe some hope as we muddle through these unprecedented times. I'm pleased to answer the call. This is my effort to reach as many people as I can in one place. So let's talk about all things related to the coronavirus or COVID-19, or some are even calling it the CV-19. To do this justice, we have to start with the status at the global level, then the federal level, and even the state level, before we can finally get to all the local activity, because everything that's happening at all levels are impacting everyone up and down the chain. Now, unlike the news, I'm going to offer the good news along with the bad. And hopefully, with all the information available, you can make up your own mind. Let's start off by acknowledging that the coronavirus is a very deadly, a very serious disease, and it acts and transmits very much like the influenza or swine flu. It starts with a dry cough that eventually brings a fever. Some report vomiting or upset stomach, but the major kicker is that COVID-19 has a much more aggressive impact on the respiratory system, sometimes resulting in pneumonia. Males are more vulnerable than women. Smokers are at a higher risk. Anyone over 65 years old is especially at risk. This disease is easily transmitted person to person. There are no vaccines. Tests for the virus are in short supply here in the U.S. Very few have a natural immunity to the coronavirus, and that virus has overwhelmed other countries in a way that very few other outbreaks have in modern history. The World Health Organization estimates worldwide mortality rates run between 1.9% to 3.5%. That ranks this disease as 20 times more deadly than influenza. That's all the bad news, which I'm sure most of you have heard. The good news is that 80% of illnesses are very mild. Very few cases have been documented involving children. The younger you are, the milder the symptoms seem to be. The World Health Organization reports that over 198,000 COVID-19 cases have been confirmed worldwide. Of those cases, over 82,000 people have made full recoveries. Just under 8,000 individuals have succumbed to the complications caused by the disease. China has seen most of the cases of COVID-19. Almost 81,000 infections, over 3,200 deaths are from China alone. The consensus is that COVID-19 originated in Wuhan, China, though the Chinese state media is attempting to change that narrative. Regardless of its origins, it appears that China has overcome the worst of the infection threat with only 8,000 active cases and only 13 new cases in the past 24 hours. Considering China has more people than all the people in both North and South America, those are very good numbers. There are some reports that South Korea may have seen their infections peak. Experts initially credited their efforts to quickly develop and manufacture testing. It is true to say that many more residents in South Korea are being reported to have been tested than here in the U.S., a point of criticism for the president, as the FDA has a cumbersome, yet much more thorough process for certifying testing facilities and those who manufacture tests. But a March 17th Science magazine article details many of the other measures that South Korea employs to track and suppress infection clusters that we don't use here. One is that when an infected person is identified, their phone data, credit card information, and other data is used to trace the person's whereabouts during the time period that they were sick. That information is then shared without identifying the patient on a social media app that helps others determine they may have interacted with the infected person. South Korea also has mandatory self-quarantine and have state officials check on anyone that is identified as a self-quarantine twice per day. There's a hefty fine for violating that quarantine. Despite all that, there are reports that new infection clusters are appearing throughout South Korea, so it may be too soon to declare that the threat has peaked. The country currently hardest hit by the coronavirus in both pure cases and in per capita cases by far is Italy. Whereas China has seen 56 infections per million residents, Italy has seen 521 cases per million residents, has identified 3,526 new cases in the past 24 hours, and has lost 2,503 souls, with 345 of those deaths reported over just the past 24 hours. For whatever reason, the media seems to be focused on countries with the highest overall COVID-19 diagnosed cases. There's been little focus on the countries with the highest rates of infection per capita. I looked this up, and of course, the countries with more than 1 million residents experiencing the highest rate of coronavirus cases per capita are all in Europe. Switzerland comes in second to Italy with 316 cases per million residents. Norway has 270 cases per million people, while Spain has 251 and Iran has 192 million residents. Again, these are all statistics according to the World Health Organization. The United States has only 20 cases per million residents, though that number has increased daily, especially recently. To date, the United States has 6,499 cases, with 1,836 new cases identified over just the past 24 hours. Only 106 U.S. cases have made full recoveries, 12 cases are critical, and 112 individuals have passed away, with 26 having been reported in just the past 24 hours. In Riverside County, 3 novel coronavirus patients have passed. There have been 16 individuals diagnosed with the disease in Riverside County. All those cases were located in the Coachella Valley area of eastern Riverside County until last night. 2 cases have been identified in Western Riverside County, according to a recent Riverside University Healthcare Systems press release. President Trump, the federal government, and the Federal Reserve all appear to have been implementing measures to combat the virus and the financial implications of an increasingly more aggressive shutdown of the nation. There's been extensive criticism of the president. All I will say is this. This is an unprecedented worldwide event that history will remember for many decades to come. There will be plenty of time for criticism once we clear the hurdle of blunting the impact of this threat. And right now, the most important thing we can do is pull together, work together, not tear each other down. History will also judge how humanity emerged from this threat, not simply how its leaders reacted or when they reacted. On Wednesday, March 17th, the White House provided several important pieces of guidance during a press conference. Citizens were being asked to restrict travel, especially those over 65 years old. They were also being asked to avoid bars and wineries and to restrict group gatherings to less than 10 persons. That echoes California's guidance issued on Sunday. A piece of potentially scary news was the president mentioned that this could last until July or August. White House officials later clarified that the president meant that July or August may be how long it takes for the trajectory of the outbreak to play out, and that there was no order lasting into July or August. Thank goodness. The president announced funding for disaster assistance loans for small businesses through the Small Business Administration. My advice is that anyone that has a business that is being impacted by the shutdown should go online and apply for an SBA disaster loan as soon as possible. You don't necessarily need collateral, and you can have less than perfect credit. As long as you can show an ability to repay, you can get a loan for as little as $25,000 or as much as $2 million and be approved in as little as 7 days. The whole country has been identified as a disaster area, so you qualify in that respect. Folks that have had their hours reduced while working for somebody else, or maybe eliminated altogether during the shutdown, should apply for unemployment immediately. It takes about a month to process claims under normal circumstances, and these aren't normal circumstances. Needless to say, the next 15 days are going to be critical in flattening the curve. We've all heard about the concept of decreasing the rate of transmissions of the virus to help keep hospitals from being overwhelmed. It's a real concern. You can track the rate of infection in other countries to kind of check this out for yourself. If the COVID-19 outbreak occurs according to original projections, there won't be enough acute care beds or ventilators to accommodate the people that need them, potentially causing unnecessary deaths. I've heard people call this a hoax or an overreaction, and I hear those concerns. While I'm not an Area 51, 9/11 was an inside job type of guy, there's no doubt to me that a shutdown will cause global recession and, worse, financial strife for millions of people. So this is a huge political decision and gamble at play here. I can understand Trump's reluctance to take actions to undermine the economy, especially when he's built his legacy and re-election hopes upon that economy. Is there a valid reason to flatten the curve? Call me a skeptic. I had to figure it out myself. According to the Society of Critical Care Medicine, an organization that keeps surveys of emergency medical equipment, facilities, and personnel in the United States, the U.S. has roughly 631,000 acute care and intensive care beds throughout the nation. If one were to count all the ventilators available, including older models and the U.S. emergency stockpile, there are only about 160,000 ventilators available. There are roughly 34,000 licensed advanced practice physicians trained to manage the entirety of everything coronavirus related. These resources are not sitting idly on standby. They are resources being utilized in some capacity right now, even as I speak. Some estimates showed that roughly 40% of these total resources are only available at any given time. Even less are available during normal flu season. If we assumed an Italian-type infection rate of 521 persons per million in population, that would equal 170,000 persons infected in all the U.S. all at one time. That's the threat, and it's a very real threat. In terms of COVID-19 readiness, guess which country has the most critical care beds per capita in the entire world? Could be China. They got through the virus with their 3.6 beds per 100,000 citizens. No, it's not China. It might be the United Kingdom with 6.6 beds per 100,000 citizens. Nah. How about Italy? They're dealing with it with 12.5 beds per 100,000 residents. Nope. Maybe strong Germany with its whopping 29.2 beds per 100,000 citizens. Could they be the one? Well, ladies and gentlemen, you'll be glad to know that the good old US of A, with its horrible privatized healthcare system, we somehow lead the world with 34.7 beds per 100,000 residents. That is 10 times more than China and 3 times more than good old single-payer Italy, where the elderly are being left without treatment due to healthcare rationing. So in terms of capacity in handling a once-in-a-lifetime threat, our healthcare system is better prepared than any other country in the world. That's good news. Now, for anyone who believes that we're heading toward an Italian-style, out-of-control outbreak, you got to consider the timeline. I'll remind folks that Italy shut down schools on March 6th. At that point, they had 3,296 cases and 148 deaths attributable to COVID-19 at that time. They only closed bars and restaurants just 7 days ago, once their total cases had surged past the 12,000 mark and their deaths had risen beyond 827 individuals. Now they have 31,500 cases and 2,500 deaths. That was just in the last week. The U.S., by contrast, has 6,499 cases. We're on lockdown. We have better survival rates. Plus, we're way more spread out geographically speaking. So that's the big picture on the national and global levels. Let's shift our focus to the response here in California. On Sunday, Governor Newsom asked persons over 65 years old to shelter in place. He also asked bars, wineries, gyms, nightclubs, and entertainment venues to close down until March 31 or longer. Restaurants were asked to close their dining areas and offer takeout only. He prohibited visitors for elder care facilities. Again, these precautions are warranted. California has a sizable boomer population. The U.S. Census Bureau estimates roughly 5.7 million Californians are 65 or older. The state estimates about 8 million Californians have cardiovascular disease, 2.5 million suffer from diabetes, and 2.3 million have asthma. Of the 335 California cases of COVID-19 counted as of Sunday, 116 of those cases were for people 65 years or older. After the government made these dramatic declarations, there were ongoing questions as to how those in self-isolation would be able to get the essentials they need delivered. The governor has promised a plan of action very soon, so stay tuned. The big authorization from the governor to local governments was in granting the power to postpone evictions and foreclosures during the state of emergency. It'll be up to counties to take the governor up on that authority, though. Regionally speaking, the counties of LA, Orange, San Bernardino, Riverside, and San Diego have all declared a state of emergency. LA County is a home to 144 cases and 1 death. Orange County has 29 cases, no deaths. San Bernardino has 2 cases, and again, Riverside County has 15 cases and 3 deaths. Fortunately, the rate of infection in Riverside County has not risen dramatically since the first case was identified on February 25th. As would be expected in a more urban setting, LA County has seen exponential rates of infection after finding their first case March 2nd. This may help explain LA's more aggressive response in terms of shuttering businesses and restricting travel in recent days. Earlier today, a respected news organization reported that Riverside County's public health officer, Cameron Kaiser, ordered that all schools, preschools, colleges, and charter schools be closed until April 30th. The previous order was to expire on April 3rd. Not all school districts have seen this order, and some are waiting to confirm that this is actually accurate. So stay tuned for that too. The county has followed the state and federal government, their lead as far as restrictions, despite there being far fewer known cases in Riverside County. The county is actively seeking facilities to temporarily house individuals that are infected, but not so sick that they need intensive care as a proactive method of stretching valuable medical resources, should the need arise. Each city in the region are drafting emergency ordinances. For the city of Lake Elsinore, efforts are underway to create safe environments for both residents and staff so that critical government amenities and services continue to operate throughout the shutdown. Planning Commission and City Council meetings are expected to continue under the current federal and state directives, and teleconferencing is going to be utilized in lieu of face-to-face conferences in as many ways for the time being. Now, it's hard to play fortune teller when it comes to predicting when we will get back to normal, especially with my crystal ball in the shop. The time frame for lifting restrictions will likely come down to a mixture of science and politics. Looking at data from other countries and considering the county's reported decision to keep schools closed until April 30th, it appears we'll be under some form of restricted activity for the next 45 days. Without some extremely compelling reasoning, I just can't imagine the public in general tolerating anything extending beyond April 30th. For the first time in decades, our nation and the world faces a great challenge. While we have all seen the unfortunate behavior of scared or opportunistic individuals, there have also been heartwarming instances of amazing humanitarian acts of good. We don't want to trivialize the seriousness of this infection that is actively taking the lives of somebody's parent, child, or friend. Just remember that that next case could affect you. At the same time, we need to put all of this in perspective. We are not under martial law. There is no curfew in effect. Businesses are closed voluntarily. There is no food shortage. There is no long-term supply shortage. I ask that we look to past generations who, when facing a global threat, were asked to make the ultimate sacrifice for the greater good. We are being asked to stay at home, wash our hands, and don't hog the toilet paper. Taking an unexpected vacation may cause you economic uncertainty or inconvenience, but in the grand scheme of things, especially when it comes to global catastrophes, this one ranks as a pretty easygoing disaster to avert. With that, I thank you for joining me. Until next time.